Hello and welcome to On the Sunny Side. I'm Sunny Grineveld. I'm an entrepreneur and Forbes Under 30 list maker, and every week I speak to entrepreneurs, business leaders, researchers, people who are shaping the digital economy and who are using tech for good. Now, if you'd like to tune in to more of these 15-minute segments, please do click the subscribe button below. This show appears weekly, and I'm really looking forward to this week's episode because my guest today is Luiza Dobre. She's the co-founder and CEO of Komed Health. Welcome to the show, Luiza.
Hi, Sunny. Thank you so much for having me here.
Well, such a pleasure. And now for those who tune in regularly to On the Sunny Side, they know I always start these shows with something I call Sunny's Fast Five. 5 questions to introduce you to my audience, hopefully short but originally. Are you ready for that?
Will do my best.
All right, let's get started. So, easy starters. Are you a morning or a night person?
Oh, that's an easy one. I'm an absolute night one.
And if I gave you a time machine and you could travel to any place and any time period that you wanted to, where would you go?
Am I allowed to go in the future?
Of course.
Yeah, I would be very interested to go in the future, 20, 30 years from now, and see how we have developed. But I think it's also quite dangerous if you would have that information for your own happiness. So this would be my initial thought, but otherwise learning from history as well.
And traveling back to the present, what is a current question that's top of mind for you?
Well, currently I'm in an investment round, so on top of my mind is very much that. How to optimize this faster so we can soon do what we have in mind, follow our plan. And on the other side, I'm also same, I guess, as all of us, I'm looking forward that COVID-19 situation finishes soon so we can go back to our normal life and travel and meeting each other instead of doing this everything online.
Now, what is success to you?
Well, I think to me, success is not a destination. It's more like an attitude and a state of mind, doing something that you love, something that gives you energy, something where you can keep always pushing yourself to learn, to become better, and also have an impact on the others. I think, success cannot be measured in any metric. So in my view, but in the journey that you take in order to achieve different goals and enjoying this along the process.
Now, you founded Komed Health. What does Komed Health do, and why did you start this company?
So 5 years ago, I left the corporate world, starting a project in healthcare. It was not Komed Health, but this is how I started to get more and more into the topic. And I came across an article saying that the third cause of death is medical error. And 250,000 of people in US are dying because of inefficient communication between healthcare providers. And so on and on. I also found data in Switzerland, 1,500 people die for this reason. And for me, it was shocking because I was using modern tools like WhatsApp or Slack or Trello or Asana. And I was wondering, how is it possible that something like this doesn't exist in healthcare? So I think this was kind of the seed that was planted in my head. And starting from that, I just more and more I started to develop this idea and really understand what is the exact problem and how can we solve it.
So Komed Health today, what do you provide?
Yes, so based on this, we basically provide a communication and collaboration platform, a SaaS platform that can be easily comparable with Slack but that is purposely built for healthcare organizations. So we sell our communication and collaboration solutions to healthcare organizations, but the users are nurses, doctor, and any other healthcare professional, in order for them to become more efficient, to have the right information at the right point in time. And how we do that is by connecting our platform with the existing infrastructure. So it's not replacing a patient dossier or a patient record. It just triggers notifications from all these different systems to the physician, to the nurse, to know that that information is ready, or that report is ready, or this is the person looking at this information, and always contextualize the information, either around the specific patient, either around a specific role, and so on. So if you think about it, that today, doctors and nurses are using pagers, decked phones, switchboard, faxes. This is a huge improvement in the way they work, in the way they become more efficient, in the way they treat patients. And this is very much in tide with our vision to improve patient outcomes and ultimately save lives.
The digital transformation in hospitals and in the healthcare sector overall seems to still be a step behind compared to other industries. How do you assess this topic, and how do you think COVID-19 is also accelerating the digital transformation in the healthcare and hospital industry?
Yeah, that's really, really right. We are at the front line of this digital transformation in healthcare with our product. And we see that COVID-19 really accelerated digitalization in the healthcare sector. We see it firsthand with our product. So we have few customers, and we realize when the peak of COVID-19 happened, we had a peak in our usage of our product, and also a group of hospitals that were piloting at that time our product, they decided to roll out our product. So this was also beneficial for us, because on one side they needed to connect the remote healthcare professionals that are outside the hospital with the one inside the hospital, being able to fastly exchange picture, videos, images, documents, and take fast decisions. And on the other side, having this security aspect, because what happened is also during COVID-19, many doctors even more started to use WhatsApp to exchange patient information. So this was very much mediatized before COVID-19, but even more afterwards, because of course doctors didn't want to wait to send a fax anymore. It was all about speed. And I think hospitals have realized that on one side they need a secure messaging solution that is modern, that is as easy to use as WhatsApp. It doesn't require a big training for the nurses, but on one side it's also connected to their systems. And on the other side, we also have seen it in Germany. Probably you read about it. The German government, right after the crisis, they decided to invest close to 4 billion euros in digitalizing hospitals for 2021. So all German hospitals who are spending 15% of their budget, IT budget, on new digital solutions, they get reimbursed. This is one thing. And in Australia, the Australian government invests about 95 or 98 billion US dollars for the next 5 years to digitalize hospitals. So we see really a huge shift in the market in this aspect. And I think, technology always existed. Technology was there. For me, digitalization is not having the technology, but changing a mindset, changing a culture, changing the way we work together.
When you look at these developments, I mean, you must be in one way very excited from a business perspective, because I guess there's not been as much openness for your type of technology pretty much since you founded the company. How are you dealing with this opportunity to just scale sort of at unprecedented rates?
So yeah, I think for us at the moment, we have quite a number of customers and new customers. We have spoken in, we started the company 3 years ago, and we spoke with more than 100 hospitals in these 3 years, even when we didn't have a product, into all these different iterations of our product. And at the moment, we are only in Switzerland, but we plan to have the first project already in a few months in Germany. And we received quite few interest from the German hospitals, who actually, fun enough, they highlighted exactly what we talked about it. The CEO of a German hospital, he opened the call, COVID-19 happened, so that's why we need to accelerate our digitalization. If we would have met 2 years ago, probably it would have taken us 1 to 2 years to get your product. Now we want it in the next few weeks if possible. So this is really it's a very interesting moment, but of course also, since we are quite a small team, we have to have agile strategies to make sure that we equip the hospitals that are interested in our product, and for this we also do a financing round.
Okay, so you're fundraising right now, which I guess makes sense given that there's clearly a lot of demand out there. How's fundraising going, and what are you looking to do with the fundraising specifically?
Yeah, so the fundraising is in process. We have quite some interested, committed investor already. So we are raising now a pre-Series A. So just before ramping up toward the big Series A that we plan to do in the next 12 to 18 months. And in order to get there, so since now we started to generate our recurring revenue, proving our business model, our SaaS model, now we have, we need to scale within this organization that have signed a contract with us, but also expanding, turning a lot of opportunities, a lot of customers who are actually at our door into accounts. Expanding to Germany, this is a key for us. And also we started, in order for us to really conquer the market and become market leader in our space, we need to also partner with big tech players in the field, telecom companies, technology companies who sell to hospitals, to healthcare organizations, electronic medical records, and so on.
I think, to me, you're really one of these sort of people and entrepreneurs who are at the forefront of this digital transformation that's happening in the health sector. What are health tech innovations that you are particularly excited about looking forward?
I think for me, until now, healthcare, the healthcare provider was the center. Now I think what is very interesting is that the consumer becomes the center of healthcare. So we are talking about consumerism healthcare, and how can we service that using all these different technologies, from AI to big data to IoT, VR and AR. And I think this is very interesting. And also another trend or another area that I'm extremely interested in is longevity, right? How can we, or biohacking, how can we stay longer, healthier, and stronger to do all the things we want to do. So I think there are a lot of new interesting things happening in that space as well.
Just out of personal curiosity, how old do you think our generation will get in terms of the longevity research that's out there? There's a lot of interesting things happen. And I'm sort of always torn between, is this just all curious but not applicable in my lifetime versus, how much of that will I actually get to try out and personally benefit from?
I know, I think about the same thing. I hope in our lifetime, right? I mean, I remember I had this thought since I was in high school. I always was fascinated by the thing that people are so beautiful and strong, and suddenly they get sick and they get old and they cannot do all the things. That freedom of health, of having health. I think when you're healthy, you have the freedom to do everything you want. And it always fascinated me, and it's still, like, I could say, one of my reach personal interest. So I am confident that there are different ways how you can biohack yourself. So, you know, what you eat, how you eat, how much exercise you do. So there are a lot of books about it. I'm sure you probably know the book of Professor Sinclair, Lifespan, which talks a lot about what he does to keep his longevity. But yeah, probably we will, until there is a vaccine against aging, I think we can all biohack. I am not a fortune teller, you know, that would be one of the things I would go in the future to find out, but then it would be super dangerous because I would know the formula. Imagine if you know too much information, you will also not be very happy, right? So I think exactly, you know, I start with what I said at the beginning: success is not a destination, it's the journey. And in the end, you know, it's tempting to know what's happening in the future, but in the end, it's like, how can we do with the information we have today better and become better?
Maybe just on that note, I'd just like to ask you one last question, which is, you know, if you could go back to when you started Komed Health a few years ago, and I know a lot of my viewers are young entrepreneurs, people who are thinking to build companies. So I sort of ask this question also for them. What would you recommend to yourself? What do you wish you would have known?
A lot of things. I think one very important thing is to always think big, and don't let the naysayers put you down, right? Because as an entrepreneur, you will get a lot of doors slammed into your face, and I think you should never take this personal. And you know, in Switzerland, it's also this thing with being modest, not thinking too big. But then if you don't think too big, you could never be like a global leader in a space, but you could maybe build a company that is servicing Switzerland and maybe the DACH region. So I think it's always, I think for me, it's very important that the viewers, the young entrepreneurs, are never like giving up, never quitting. And I think this is something I would tell to myself 4 years ago. I tell to myself today: never quitting. Success, it's only for the ones who never quit. And even if you might have some experiences that will not be as you expected them initially, use them as an opportunity to learn and become better, but never quit, and always think big, and always believe in the beauty of your dreams. And there will always be people who will follow that. So I think for me, that's a philosophy overall.
Luiza, it has been such a pleasure. Thank you so much for this conversation.
Thank you, Sunny. I wish you a lot of success as well. Thank you.
Thank you. So here on the sunny side, we are coming to a close, but I do hope you tune in next week. And if you'd just like to get the alerts on YouTube, make sure to subscribe, leave a comment, let me know what else you would want to know from future entrepreneurs, what you thought of the episode. I look forward to hearing from you, and I hope to see you next week, Friday, 9 a.m. on the sunny side.